this patient was referred to me 6 months ago for endodontic treatment of tooth number 3. So when I saw this patient, tooth had a temporary crown on it, as you can see. And patient wanted to know if he needs to get a root canal for it before he got his crown or not. I asked him if he had any symptoms. He said he had no symptoms ever since the tooth was prepped for a crown. There was just the decay, and then his dentist prepped the tooth, removed the decay, and then prepped the tooth for a crown. And as I said, he had come to see me to see if he needs a root canal before he gets his crown. So I examined the tooth, percussion, palpation, all within normal limits. Probings 2 to 3 millimeters all around, and cold tested the tooth within normal limits to cold. I told him, I said, it's up to you. It doesn't seem like it needs a root canal right now. Why don't you just wait, give things a couple of more weeks to see what develops before you have your dentist cement the permanent crown on? And he agreed. Then patient said, suddenly patient came back a month later and said, well, now my dentist told me that I need a root canal for sure. Patient said after he had left my office, he had gone to his dentist, and his dentist had cemented the permanent crown on with permanent cement. They both had decided to go ahead and do that, and he was going to take the chance, have the crown cemented, and hopefully he wouldn't need the root canal. Which the patient says, after the dentist cemented the crown on, a few days after that, he started to have all kinds of pain. He went back to his dentist, and the dentist told him, oh, well, I'm sorry, you took the chance, but you need a root canal. So his dentist went through the crown to do the root canal, and after 1 hour of working on this tooth, according to the patient, his dentist told him, I can't do the root canal. I can't do it. And guess why he can't do it? Guess why he couldn't do the root canal? Take a look. Take a look at these. Look at the angulation of these roots. I mean, look at this. It's like this. That's the root. This is the canal. It's like this. So after 1 hour of working on this tooth, the dentist said that he couldn't do it. He couldn't do it and referred the patient to us to go ahead and try to see if we can do it. Now, of course, what had happened was that there were all kinds of problems, ledges and blockages and all that stuff, because this dentist had tried to do the root canal, just made things worse for me. So I went through the previous endo access and removed the cotton pellet that was placed in the pulp chamber. Then I noticed that this dentist had gone through a huge pulp stone in the pulp chamber to do the root canal. And very likely from the pulp stone, because he hadn't removed the pulp stone, he had gone through the pulp stone, so he hadn't cleaned out the pulp chamber. So his access through to the canals was through this pulp stone. So he probably pushed some of the bits and pieces of pulp stone into some of the canals. So it took me a while to just clean everything and just try to bypass the ledges and remove the pulp stone and made sure everything was nice and clean and complete the root canal. And this was the best that I could do for this tooth. Take a look. It was immediately after I had done the root canal on this tooth. And here's the date, as you can see, and this is today's date. So I would say 7 months ago. And I told the patient, I said, this is the best I can do. So you can see 1, 2, look at that. Beautiful anatomy there. Look at this anatomy here. Look at the loop. Look at the distal buccal. I just could not go any further than that. Look how short I was. And the palatal, of course. And I told the patient, I said, this is the best I can do. So come back, please, to see me in 6 months or sooner if there are any issues. And he said, fine, okay. So he came in today, 7 months after we had done this root canal for him. And take a look. Here it is. 7 months post-op of tooth number 3. Patient still has the same crown that his dentist and then later me went through to do the root canal. And take a look. 0 symptoms, percussion, palpation, all within normal limits. As you can see, no periapical relucencies or issues. And here's the date, as you can see. And this is today's date. Today, just now, he left just now. 7 months post-op of tooth number 3. Tooth is in full function. Patient has no symptoms, no issues. I used copious amounts of 6% sodium hypochlorite, sonic and ultrasonic activation. And as you can see, perfect. The root canal may not look perfect, but it did the job. It did the job. So short fill here, short fills here. Short fills, long fills, flush fills. Remember? The extent of obturation doesn't affect the outcome of endodontics as long as, of course, there are no bacteria in the canals. And here it is, 7 months post-op of tooth number 3. Tooth is in full function. Patient still has the same crown. Endoaxis was restored with composite. Percussion, palpation all within normal limits. Probings 2 to 3 millimeters all around. No periapical relucencies, no issues, no disease. Patient was extremely happy. He just left. And there you go. 7 months post-op of tooth number 3.